Hello, everyone. My name is Yuz Yusof. I'm reporting for Room Now. I'm calling from Leeds, United Kingdom, and joining the ACR conference as a virtual delegate. Today is the last day of ACR. I know it's a bit sad. However, there have been jam-packed contents that have been that we learned today in the conference. And one of the abstract that caught my eyes is abstract by Dr. Jacquelyn Nestor and her teams. Thank you, Dr. Nestor, for coming and joining us at Room Now.
Thanks so much for having me.
So the abstract number is 1654. So this is about the impact of the outcomes of hydroxychloroquine lower dose. So Jacquelyn, would you like to tell us the rationale behind the studies and what were the study objectives?
Yeah, so the rationale behind this study is that, we know hydroxychloroquine has lots of benefits in our lupus patients. It increases overall survival, decreases flares, decreases cardiac and renal involvement, but we're limited by the possible side effect of hydroxychloroquine retinopathy. And over the last 10 years or so, the American Academy of Ophthalmology has introduced new guidelines, first reducing the dose to less than 6.5 milligrams per kilogram per day, then to less than 5 milligrams per kilogram today, which for most patients led to a dose reduction from the standard 400 milligrams per day that they were receiving, since most lupus patients weigh less than 80 kilos. And so that was sort of our rationale, was to understand whether or not these dose changes were having any effects on lupus flares leading to hospitalizations.
So looking at your the design, when you read the abstract, it could be a little bit complex. However, it was quite straightforward when you actually looking at the diagram. So in summary, like how do you summarize your design, this crossover study design?
Yeah, so the really nice part about our study is, so it's a case control study design, is that patients are compared to themselves. And so patients had case periods where they were sick on hydroxychloroquine for 6 months and they ended in a hospitalization for lupus flare. And then they also had control periods, which were 6 months that they were on hydroxychloroquine and did not end in hospitalization. And so we were able to compare these case and control periods, and then also look at what their patients' average hydroxychloroquine dose was during this period in order to compare their risk of hospitalization.
Oh, thank you. Yeah, so much easier to understand now.
The picture helps.
So could you please summarize your main finding and your key outcomes?
Yeah, so our main finding is that decreased hydroxychloroquine dosing, both by weight-based and by non-weight-based dosing, was associated with increased risk of hospitalizations for lupus flares. And so maybe we need to reconsider these guidelines, get back in touch with the ophthalmologist and look at maybe some revisions on these, whether or not, we do want to prevent retinopathy, but that's something that's not going to happen for 10 to 20 years. In our patients, in the short term, we have the very real side effects of lupus flares, which cause end organ damage, which cause more steroid exposure, and then all the side effects that come with steroids. Maybe our lupus patients who are earlier in the disease need higher doses, and maybe the lupus patients with more active disease need higher doses. Maybe it's not a one size fits all type of guideline that we need to have.
Yeah, correct. Yeah, because we've been getting so many data now over the last 2 ACR as well. Like like your data is amazing. I mean, it's about hospitalization. I mean, this is a serious endpoint for a whole patient, like severe flare-up of lupus. And there's been a few more studies presented as well, saying that it affect the mortality, damage. So I think we do need to look into this. And do is any group or like the Americans some organization or anything that actually trying to review this guidelines again? Do you have any idea of that?
There's definitely interest in reviewing these guidelines and trying to get in touch, talking with ophthalmology about these. They're currently a Medicare marker in the U.S. for that you have less, that your people are on the correct doses. So now I think we have some evidence to bring to the table as to why people were a little bit up in arms about when these guidelines first came out in 2016.
Yeah, I think that's really great. And I know that from a European point of view, I think they are revising the SLE guidance and also in the UK. So I think, potentially, as we can feed back to this organization when they're trying to design the scope and trying to do a systematic literature review to focus on this aspect as well. I think that will be useful and hopefully can, try to solve the problem out that, we are reducing the dose. So, yeah. I really, so thank you so much for joining us at Room Now. We really appreciate it, and we learned so much from your study as well. And I hope you do too. So follow us, follow the Room Now, either through the Twitter, LinkedIn, or YouTube for more coverage from the ACR. Thank you and goodbye, everyone.